This is one of the biggest questions we get. What we don't want to see is, okay, good morning guys, Dr. Sharma here. My team have asked me to make a quick video as we have many patients who either call in or leave comments on our YouTube channel asking about what are the possible complications that can go wrong in the first week, what should patients be looking out for, and what are the red flags, and just sort of reel off some things which I think are normal and which are not normal. Please remember this video is for educational purposes only, and you must always consult with your own healthcare provider for any details pertaining to your own individual case. So let's take this logically step by step. Let's talk about what is normal, and then we can talk about what's abnormal. The first day you may have some discomfort post-op. You'll probably be given a bandage around the donor site, depending if it's the FUE or the FUT procedure, and you'll be given post-op instructions. Most of you will be on antibiotics and a few painkillers the first day as well. First day to first 3 days, you probably notice some swelling around the forehead, around the recipient area, the crown, where the implantation has been performed. This swelling can typically migrate down into the forehead, around the eyes over the next couple of days to the 1 week mark. Your scalp will feel a little bit funny, might feel heavy. It might feel like the sensation is significantly altered compared to your neck or where the surgery was not done. And this is because you have had regional anesthesia or a very large local block. So it does take time for the sensation to come back. So do give it a couple of days. And the first couple of days, this is entirely normal. Around day 4 to day 7, you will start seeing some crusting and scabbing around the recipient area and the donor area as well. And once again, this is entirely normal. Depending on where you have your surgery done, you'll be advised on how to take care of this. We typically want our patients to keep this area hydrated with a specialized solution. And also we want our patients not to pick it or have any contact with the recipient area. So day 3 to day 10, you will have some redness or erythema, as we say in the industry. It's simply increased blood flow to the scalp because of the inflammation and the trauma to the scalp. It's literally your body trying to bring in more nutrients and blood supply to this area, which allows healing. And this is entirely normal. This color will fade, and over the next couple of weeks, if you have light colored skin, you might see a small salmon twinge, and that's entirely normal as well. Now let's talk about pain. You'll typically be provided with some analgesia, usually oral, by your physician. Typically we perform a anesthetic block so the patient can go home so they're pain-free overnight. But typically by day 1 to day 3, the discomfort really comes down, and it's manageable with normal anesthesia. After day 7, it's very common to experience itching around the back of the scalp or even the recipient area. Once again, this is part of the healing process. Very important you don't pick or jab at any of the grafts or scabs. Now let's talk about what's abnormal and what you should not be waiting around for, and actually contact your healthcare provider immediately. Fever, there's no night sweats, no chills. These must all be reported to your healthcare provider, and make sure you stay on your antibiotics as directed by your own individual provider. You've literally received thousands of microcuts to the front, top, and the back of the scalp, and infection risk is highest during the first couple of days. It's normal for the scalp around the back and the front or the crown area where the work has been done to be slightly red. What's abnormal is if you start to see your scalp turning very dark, dusky, purple or black. This is a sign of insufficient blood supply to the area, and once again this should be reported to your physician immediately. We talked about what was normal in terms of having a slight tinge to the back of the scalp or the recipient area, where you see small areas of oozing or fluid, but what we don't want to see is heavy blood loss. If you find that the donor bandages are completely soaked in blood, or you're actively bleeding from the recipient site, once again, this must be reported to your physician immediately, and it's something not to really wait around at home for. And finally, this is one of the biggest questions we get, normally around day 5 to day 12 of post-op. is patients will often become quite concerned as they see hair follicles, which they think are hair follicles, on their clothes, and they feel the graft has failed, it's fallen out, and they often call in quite concerned. What's normal is the scabbing, the dead tissue and hair, which we take from the back, that will fall out naturally over day 5 to day 12, and that's entirely normal. So scabs, bit of dead hair, dead skin, entirely normal, nothing to worry about. What's abnormal is you see the follicle coming out with active bleeding. If there is active bleeding past day 5, this likely means that the follicle has come out in terms of the entire follicle that we've implanted, because the layer of skin where we implant the follicle is very vascular. So without bleeding, entirely normal. With bleeding, go and see your healthcare provider. So this video was improvised just off the top of my head. Hope this helps. If you feel there's any extra detail you'd like or how we can make this better, please comment below and we're very happy to make another one. Thanks very much.